this time, I would like to formally begin today's webinar and introduce Judy Wilson.
Good afternoon, and welcome to our session on developing meaningful message, putting research into practice. This session today is part one of a two-part series that focuses on creating inspiring tools using these consumer-tested resources. I'm Judy Wilson, and I'm Senior Nutrition Advisor with the USDA Food and Nutrition Service. Other speakers today include Joyce Patterson, who is a consultant with HGM Management and Technologies, and Sarah Sloan, who is nutrition consultant with the Oregon Health Authority. The objectives of today's session are listed here. As noted, we will focus on providing a project overview. We will discuss the key research findings and preview these materials with you so that you know what is available. We will also share ways you can apply the messages into practice. Those registered for the offline component will gain additional insights through hands-on activities. So we will start with the project overview, the process, and the key research findings. As you know, there are many messages, and consumers are sometimes confused by what appears to be contradictions. The core nutrition messages are part of the Food and Nutrition Service's overall efforts to promote use of consistent science-based messages across the nutrition programs. They help us to speak with one voice while addressing key barriers that low-income consumers face in putting the Dietary Guidelines for Americans and My Plate into practice. They do so by addressing some of the key barriers and mediating factors and presenting this information in ways moms find relevant, feasible, and that inspires them to make positive changes in their behaviors. Many of you work with the nutrition programs, so you know that together we reach millions of low-income people every day and certainly every year. And by working together, we can maximize our impact. We use a collaborative, audience-focused developmental approach that included key partners in the developmental process. During all three phases, we had this work group in place to, one, inform the development of the messages, and two, to get ongoing input from the group that we ultimately wanted to use these resources. The stakeholders also included F&S program staff, the Center for Nutrition Policy and Promotion, the people who do the Dietary Guidelines in My Plate, and Porter Novelli, a marketing and research firm, worked with us to test and to finalize the messages. We use a developmental cycle based on the model created by Sue Bora and her colleagues. However, instead of a 4-step process, we use the 6-step process you see here. And the one thing I want to point out to you is that the expert panel defined the audience, they defined the behaviors, and the message concepts that were eventually tested with the audience. So they played a key role. The work group also identified moms as a very important audience since they are the primary nutrition gatekeepers and are also very important role models for their kids. And as you can see, the topics and behaviors that we focused on, including meeting the dietary guidelines for the food groups and establishing child feeding practices that contributed to lifelong healthy eating. We tested the messages in locations across the country, and as you can see, we did 54 focus groups in English and 6 in Spanish. Over 75% of those involved participated in one or more of the nutrition assistance programs. Race and ethnic groups of the moms was diverse, as illustrated here, and about 52% of the English-speaking mothers were employed compared to 26% of the Spanish-speaking Mexican-American moms. And the English-speaking mothers also reported higher educational levels, as you could see on this slide. The project started in 2006 and consisted of 3 phases, starting with phase 1 and will conclude with phase 3 this fall. Phase 3 involved the translation and modification of these resources for Spanish-speaking Mexican-American moms. So, what did we learn from mothers? Well, mothers have a general awareness of the food groups, but they lack a deep understanding of some of them. Fruits and vegetables are top of mind when it comes to healthy eating for our mothers, but whole grains were mentioned much less often. And most agree that all of the food groups are important as they work together for good health. So I thought this was a very important finding. In terms of fruits and vegetables, again, they were top of mind for moms, for their kids' healthy growth and development. But most moms believe that fresh is much healthier than canned or frozen and rejected messages that suggested that frozen and canned be used for this reason. So we have some work to do there. Most of the mothers liked and were inspired by the idea of involving kids in choosing what veggies to have and to help in preparing them. In terms of milk, they agree that milk is important for their children's development, but many believe that they get enough at school and were not clear on how much kids need. Most of them still serve their kids 2% and whole milk, but in the last round, we did note that more and more were mentioning that they were hearing about, 1% or less through WIC and through their SNAP education. Taste and the belief that whole milk contains more nutrient than lower-fat varieties poses a strong barrier to use of other types of milk for many, and this is consistent with other research as well. Mom sees low-fat milk as diluted or watered down. So the current availability and the richness of the low-fat ultra milk may help to diminish this issue. So this is something that you might want to direct moms to, is to buy the ultra low-fat milk, either the 1% or fat-free. They also view milk as primarily a source of vitamin D and calcium, but they had an aha moment when reminded that it has 9 key nutrients to help kids grow, glow, and go. In terms of the whole grains, mothers showed significant confusion and lack of knowledge about identifying them. They were not familiar with the health benefits of whole grains. And when asked why they do not buy and consume more whole grain foods, they said that they and their kids do not like the taste, and they don't want to buy them because they don't want to waste food. But mothers were very responsive to information about the nutrients and health benefits of whole grains. Overall, in testing, they had a strong positive reaction to information that was new or novel regarding the nutrients and the long-term health benefits. But they really depended on visual clues as proof that a food is whole grain and were reluctant to read the labels to confirm. That is, if it was brown, they were more likely to think that it was a whole grain. And that is why you see in the message later that we're saying, look for 100% whole grain, because they really don't want to read the labels to see whole grain first. And in terms of child feeding, all mothers appreciated and aspired to having family meal times, but most find meal times stressful and messy and describe their kids as picky. And I'm sure that many of you who have kids can relate to that. They struggle with their preschoolers to get them to sit down and to eat certain foods. And many moms prepared their kids' food from the stove and gave it to them, and they were skeptical about the idea of letting their child choose whether or not to eat or to choose how much to eat. They wanted their kids to eat at least a little or some at dinner, and many did not believe their children when they said, "Mommy, I'm full." Mothers want to be good teachers and found the words learning and leading to be compelling in the role modeling messages. So that's something to keep in mind. In terms of their information-seeking behaviors, they were all, every single one in our focus group, had regular access to computers and the internet, but their levels of use and comfort varied. They all had cell phones with internet access, and about 25% of them had smartphones. But cell phones were not their preferred method of getting information. For those who were willing to get information on their cell phone, they wanted to be able to opt in. In other words, they wanted to choose whether or not to receive that information. Mothers stated that they looked for resources that were similar to what Joyce will be showing you later in terms of the supporting content, such as tips pertaining to meal preparation, recipes, parenting skills, etc. But they still like traditional outlets, such as getting information in doctor's office, magazines, cooking shows, and other dieting resources. Now, many of you work with mothers, and based on your experience, have a good idea about what they would like. But people change on a continuous basis. Therefore, it is critical that we periodically check to make sure that what we are trying to communicate is what the consumer hears and understands. More importantly, we need to confirm that consumers find what we are communicating relevant, realistic, believable, and inspiring. So let's go to our first poll. It has a few of the messages that we tested with moms of preschoolers. We want you to select two you think resonated most with mothers. Make sure that you click done after you make your selection. We will then look at what mothers said and compare it to your results. If you're in the room with multiple attendees, just note your choice so that you can compare it to what mothers said and to what your colleagues think too. So while the results are being tallied, let's take a look at what moms like best. Well, they selected start them early with whole grains and happy kids, happy tummies. Start them early with whole grains resonated strongly with mothers in all groups. They agree that introducing their children to whole grains early makes a whole lot of sense and make the process of serving whole grains easier and helps them to form that habit early in life. When mothers heard happy kids, happy tummies, many of them laughed out loud. They found this message cute, catchy, and real. They appreciated the information about whole grains and how it can make potty time easier, which was considered by them to be important and very personally relevant because most mothers have to deal with this. And while whole grains first was well received by some mothers, many did not like the call to action, which was reading the labels, as I mentioned earlier. And most mothers strongly disagreed with the notion that whole grains would make their house a powerhouse. So let's look at what you thought. All right. So many of you agreed with the mothers, but some of you thought A and C were good messages too, and so did I. This just reinforces the importance of testing. But let's do another quick poll. This time, a few messages of the milk messages that we tested. Take a minute to determine which of these which one, only one this time, mom found most relevant, motivating, and engaging. And remember to click done when you are finished. So while this poll is being tallied. Let's look at what mothers said here. Mom said overwhelmingly that there's no power like mom power because it evoked feelings of empowerment, and this message resonated with moms of both preschoolers and elementary age kids. They agreed that they have a great deal of influence over their children's behaviors and their habits, and but a few of them thought that this idea was about control, what mom says goes. So in your communication, you have to be clear that this is an empowerment message, not a control message. We eliminated love and nourish them, which many saw as demeaning and belittling to everything else that they do for their kids, and set the table with low-fat milk, and said the example was rejected because moms don't want to drink milk at meals, or they didn't consider it feasible because they do not set a table. So let's look at how you replied. All right, so most of you agree with the moms, but a few still, like the other messages. I mean, love and cherish was one of my favorites, so I was really disappointed that they didn't like that one. So I think that the important thing here is that while our experience in working with mothers is valuable, consumer testing can tell us if our perceptions match reality of today's mothers, because mothers and the technology is changing. In conclusion, messages that resonate with moms tap into their emotions and emphasize the influence they have on their children's lifelong habits. The findings underscore the need for the communication tools to be flexible and to fit into the busy lives of moms. And finally, it is important to highlight the health benefits of using simple, plain language to provide concise information about nutritional content and to address the reasons mothers should follow the call to action using inspiring words that tap into their emotions and their aspirations for their kids. The core messages can help by jump-starting the resource development process because a lot of the formative work has been done for you. Now, Joyce will share with you some of the core messages products. Joyce?
We're now going to take a look at all of the final messages that were developed, along with the photos that were tested with these messages, and we'll also look at the tips, advice, and guidance that was developed to support these messages. Together, these elements speak to moms in ways that are emotionally relevant, motivating, informative, and easy to understand. There are a total of 29 messages that focus on child feeding, whole grains, milk, and fruits and vegetables. And of these, there are messages specifically for mothers of preschoolers, others for mothers of elementary school kids, and some of the messages are appropriate for both mothers. There are also messages for kids aged 8 to 10 years old. There are over 35 pages of tips, advice, easy recipes, and guidance, as well as tested photos. And there are also ready-to-use online communication tools, as well as activity sheets and a video game for kids. So educators can use these materials to create a variety of educational resources, such as print materials, digital presentations, web resources, or video and audio materials. And an implementation guide is available to help guide you in your planning and development of these resources. Okay, so first we're going to look at the 8 milk messages that support the My Plate consumer messages about making the switch to fat-free or low-fat milk. The core messages address the mediating factors, barriers, and beliefs that are specific to moms, encouraging them to continue to serve their kids milk and inform them about the health benefits of switching to low-fat or fat-free milk. So in the following several slides, we're going to be showing all of these messages in their entirety. And if you are unable to read through the entire messages throughout this presentation, please rest assured that these are all available online for you to access. Okay, so In focus groups, mothers related to messages that spoke to the influence they have over their children, their lifelong habits, and their health, and findings also suggest that mothers drink considerably less milk than their children. The messages shown here are for mothers of preschool children. There's no power like mom power, mom is a child's first teacher, and strong bodies need strong bones. They emphasize mom power and role modeling and also encourage mothers themselves to consume low-fat or fat-free milk. The first message, there's no power like mom power, can also be used with elementary school moms. These messages are for mothers of elementary school kids. They're still growing and milk matters. Studies show that milk consumption starts to decline when kids become school age. In focus groups, many moms felt that their kids got enough milk at school and few consumed milk with their dinner. These messages remind elementary school moms that their kids are still growing and milk is still an important part of their diets. There is also supporting content available to support this message, and that helps moms understand how much their children need, ways they can increase consumption, and why milk is important. In focus groups, kids agreed that good health is important, and one of their top reasons for staying healthy was to have more energy. They also identified physical activity as important for staying healthy, and these messages speak to these concepts and reinforce the importance of milk for powering up and playing hard. There are 5 whole grain messages that support and reinforce My Plate consumer message of making at least half of your grains whole grains. In focus groups, moms expressed significant confusion about whole grains, as you had heard earlier, and the core messages aim to address this confusion and help mothers understand which foods are whole grain, how to identify foods made with whole grains, and why whole grains are important. The messages shown here are for mothers of preschool kids. Whole grains make a difference, and start them early with whole grains. The message at the top can also be used with elementary school moms as well. Overall, moms were especially responsive to information about the health benefits of whole grains, as well as tips for getting their kids to eat more whole grains. Many preschool mothers in testing related to this message, happy kids, happy tummies. Difficulty with potty time was a common issue among them. And interestingly, when we translated this message into Spanish and tested it with Spanish-speaking mothers, they preferred the message to say, happy tummies, happy kids. So this is just an example of the importance of formative research and testing your materials with your target audience to make modifications to ensure that you're achieving maximum impact. Here we have messages for mothers of elementary school kids. Give yourself and those you love the goodness of whole grains reiterates the My Plate message of making half your grains whole grains, and this message is also appropriate for mothers of preschool kids. The message, Start Every Day the Whole Grain Way, capitalizes on the fact that breakfast is the time when people are most likely to serve whole grains in their meal. The message encourages mothers to serve whole grains before school to give their kids a good start to their day. There are 5 fruit and vegetable messages that reinforce the My Plate key consumer messages of making half your plate fruits and veggies. These messages encourage mothers to increase accessibility in the home, set good examples, and involve kids in choosing healthy foods. Research shows that these are effective approaches to affecting behavior change. In testing, the messages, they learn from watching you and they take their lead from you, resonated strongly with moms of preschoolers. Many moms reported that they've observed their kids copying or mimicking them, and many moms also considered themselves to be role models for their preschool children, so they found these messages to be believable and relatable. These messages for elementary school moms spoke to the common experience of kids coming home from school hungry and looking for a snack. These messages encourage mothers to keep fruits and veggies in easy reach and to involve their children in making healthy choices. Kids may be more likely to eat foods if they choose themselves. These messages were appealing to kids age 8 to 10 because they preferred messages that melded fantasy with being the best you can be. These results were consistent with other research that showed that this age group is motivated by the ideas of having more energy, being strong and fast, and maximizing their performance at play or sports. There are 9 child feeding messages that promote cooking and eating together, role modeling, and the division of feeding responsibility. These following messages are most appropriate for mothers of preschool children. In focus groups, mothers often associated mealtime with ideas of togetherness, family time, and communication. Virtually all mothers aspire to have family meals, and the messages cook together, eat together, talk together, and make meals and memories together spoke to these aspirations. Patience works better than pressure, and let them learn by serving themselves address the division of feeding responsibility. They encourage moms to provide healthy choices from which kids get to choose, to allow their kids to serve themselves, and to teach their kids to listen to their own hunger and satiety cues. While many moms were skeptical about the idea of letting kids serve themselves, the idea was actually more highly accepted when the words learn and teach were included in the message. The concept was much more appealing when presented with the idea of helping their kids advance developmentally. Mothers who exhibited some skepticism about DFR were responsive to messages that emphasized the long-term benefits of good health and lifelong habits. The message, feed their independent spirit at mealtimes, again highlights the opportunity for children to learn healthy habits when allowed to make their own food choices. This message and let go a little to gain a lot are also appealing for mothers who are preparing their children to start school and to learn how to be more independent. While some mothers struggle with the idea of letting children decide when and how much to eat, they were responsive to the idea of removing pressure from mealtime and making it more relaxed and enjoying each other while enjoying family meals. Many moms related to the message, sometimes new foods take time, and believed that it reflected their own experiences, and it reaffirmed for them that they were doing the right thing by continuing to offer a new food and to keep trying. Mothers are often concerned about whether or not their children are getting enough nutrition, and this message provides mothers with that peace of mind that if their child only eats a little at one meal, they will likely get what they need over time and in other meals and snacks. The mothers who were open to DFR related to this message and felt that it reflected their current child feeding practices. So now we're going to take a look at the tips, advice, and guidance that were developed to support these messages and provide moms with the why and the how to implement these behaviors. Again, there are over 35 pages of narratives, mom-to-mom stories, bulleted tips, questions and answers, interactive tools, and recipes. The content reflects language that resonated with mothers during our focus group testing, and materials range from stories for mothers who are just thinking about making change to actionable tips for mothers who are ready to take action. When you download these materials, the supporting content is shown with suggested core messages. However, you can mix and match portions of the supporting content with appropriate messages and photos and other tips in ways that are going to be most applicable to your audience, depending on their demographics, their stage of change, or other factors that are relevant to the objectives of your intervention. Here we have an example of a mom story, using mom power for good. For this story, many mothers found it to be relatable, informative, and helpful, and again, it addressed mothers' sense of empowerment and the influence they have on their children's development. They especially liked that it included practical information about how they can increase their family's consumption of low-fat or fat-free milk. You can use mom stories as inserts in newsletters where you can match it with an appropriate core message, or you can incorporate them into blogs and combine them with tips or recipes. And as you'll see later when we talk about communication tools, this format can also be presented orally, where dialogue in a video was taken directly from the story. Storytelling has always been an effective way of communicating, and now social media makes it an even more powerful tool, and the possibilities are endless. This is an example of a question and answer format. This answers the question, how do I know my kids are getting enough food and nutrition? There are also other Q&As for questions like, does fat-free and low-fat milk deliver the same nutrition as whole milk? Or, why should I let my kids make decisions about which foods and how much to eat? And there are many more Q&As for frequently asked questions that you likely hear often in your practices. Mothers especially like actionable advice. Through bulleted tips, you can provide moms with strategies and actions they can take to make behavioral changes. In the example shown here, there are a lot of bullet points listed. And bullet points are great because mothers like to have choices. However, you don't have to use all of the bullet points at one time. We recommend selecting 2 or 3 points that are of specific concern to your audience and focusing on just a few behaviors at a time. In this advice from a nutritionist, mothers valued this information and considered a nutritionist as a highly credible source. This content put many moms' minds at ease about the sporadic eating habits of their children, and many were relieved to hear that it's common for kids to sometimes not eat or just eat one food. Again, this format is a ready-to-go tool that can easily be inserted in newsletters, blogs, in printed, digital, or spoken formats, and you can use the entire story or just take excerpts from it. Here we have an example of an interactive tool that you can use to assess whether the moms in your audience can identify whole grains, and there are other similar tools that are available that you can use in other assessments or goal-setting exercise with your audiences. All right, in the focus groups, mothers demonstrated significant confusion about whole grain foods and how to identify them. So here in this supporting content, we address this confusion and help mothers understand which foods are whole grain as well as how to identify foods with whole grain ingredients. And on the next slide, messages and supporting content that explain the health benefits of whole grains were generally top rated among mothers. And in this content, mothers gain understanding about the fiber and nutrients in whole grains and how eating these foods may help maintain overall health for them and their children. On the next slide, we share examples of several easy recipes that are available for moms to try to help their kids eat more whole grains or low-fat milk products, like a wake-and-make burrito, a whole grain pita stuffed with veggies and cottage cheese, or a healthy pizza, or a parfait moms can make with their kids. And then on the next slide, we have examples of activity sheets for kids, which allow them to learn about healthy eating in a fun and interactive way. And focus groups show that having a game, activity, or other engaging items, such as an easy recipe, was clearly important to capture kids' attention and help convey the messages. So now with the next slide, we're going to introduce the communication tools. Now that we've seen the many messages and the variety of tips, advice, and guidance that's available, let's briefly look at the communication tools that FNS has also developed. These tools are not only ready-to-use tools that you can start using today, but they are also examples of how these messages and tips can be applied in a variety of formats to provide your audience with multiple modes of learning. On the next slide, you'll see that there are 3 YouTube videos available, one for child feeding, one for milk, and one for whole grains. And each video is about 2.5 minutes long, and the dialogue, as I mentioned earlier, is drawn directly from the core messages, mom stories, tips, and recipes. You can add a link to these videos on your web pages or in your communications to share with your audience, or you can copy the code from YouTube to embed the video directly onto your website. On the next slide, we show you that there are rollover widgets, which can also be downloaded to your website. And there are rollovers for child feeding, whole grains, and milk. And again, the content is pulled directly from the core messages and related tips. On the next slide, you'll see that for each of these rollovers, when you hover your mouse over each photo at the bottom, a tip appears in the box below. And on the next slide, as you'll see, there is a different tip that appears for each photo, and no clicking is necessary. So the rollover format addresses a common concern among mothers that by clicking on something, they will introduce a virus onto their computer. All right, and on my last slide, there is an online game that is available for kids that allows them to have fun while learning about low-fat milk, fruits and vegetables, and whole grains. The game has a track and field theme that features 4 events: javelin, high jump, long jump, and dash. And for each event, there's a question and answer format that improves knowledge, motivation, and skills in making healthier choices. The questions are time sensitive, and the faster they answer the question, the better their score. This concept was well received in focus groups, and kids found it challenging and fun, as well as a game that their teachers and parents would approve. So as you can see, there are a wealth of messages and tools available that you can incorporate into your current educational programming. I'm now going to hand it over to Sarah, who is going to discuss how you can put the core nutrition messages into practice.
Okay, so as you've heard, the core nutrition messages are designed to reach and resonate with low-income mothers and 8 to 10-year-old children. The messages and their supporting content can enhance theory-based interventions that address the behavioral outcomes the messages cover. In the next 10 minutes, I will review some of the ways you can integrate the messages and supporting content into ongoing nutrition education activities. I will discuss a few of the things you should consider and strategies for incorporating the messages and related topics, advice, and guidance into communication channels. Given that, I want to emphasize that it is very important to be aware of your audience's preferences for ways they prefer to receive information and the methods that will provide the best results. As covered earlier, the core nutrition messages support national and USDA nutrition goals. The messages can also be used to support program policy and procedures, including the WIC food package, Child Nutrition Program meal standards, and SNAP Ed guidance, thus helping to connect and strengthen the nutrition education components of these programs. Nutrition educators can utilize a variety of engaging and educational approaches to help program participants improve their eating habits. With a little planning, you can easily incorporate the core messages into many of these efforts. Think of them as like building blocks that can enhance and add new vitality to your nutrition education efforts. So when planning your activities, it is important to consider your audience and make adjustments for cultural relevance to better meet the needs of the populations you serve. For example, if a large portion of the participants you work with have religious beliefs or practices that preclude serving milk or milk products with certain foods at meals, you can modify the supporting content to offer appropriate alternatives, such as serving milk or milk products at snack time instead of dinner. When possible, test your modifications with the audience to ensure the information is clear and that it has the intended effect. Research indicates that using multiple delivery points, as well as a variety of communication tools and ways to disseminate consistent messages to the individual, family, community, social peers, and public policymakers, increases the likelihood of success. Multi-level and multifaceted methods increase the audience's exposure to the messages, and it allows more opportunities to share the information with them at critical decision points. Therefore, it is important to know where to reach moms and to understand the communication methods that actively engage them. Audience research and community assessments can provide insights on how to reach low-income mothers, such as where they live, work, shop, get services, and spend free time, what nutrition programs they participate in, and how they like to receive information. Federal Nutrition Assistant Program data can provide valuable information, such as authorized WIC and SNAP stores with high average monthly benefit redemptions, program sites serving large numbers of moms, schools with high percentages of kids receiving free meals, and child care and after-school programs participating in the Child and Adult Care Food Program. Nutrition assistance programs may also conduct consumer surveys to get feedback on services. These types of data and survey input may be useful in your planning for how and where to reach your audience. We know several of you on the webinar today have begun to incorporate the messages in the work that you do, and we appreciate you sharing that with us. Now I'd like to briefly highlight some of the ways the core messages can be applied using a variety of methods and in different programs serving low-income groups. You can easily incorporate the messages into both individual counseling and group education encounters. For individual education, the information can be presented in a circle chart format, allowing mothers to choose the topic they are most interested in. The rollover widgets and video clips can be used interactively to help provide information about consuming whole grains, switching to low-fat milk, and focusing on family meals. For group sessions, you can show the videos during facilitated discussions, use the supporting content to address questions or concerns that come up. You could then offer participants a take-home handout featuring the core nutrition messages and supporting content as a way to reinforce the group discussion. In addition, you can integrate the messages into anticipatory guidance, which can help moms prepare for expected physical, social, and behavioral changes during their children's current and approaching age of development. The discussion outline you see on this slide is one of the Massachusetts Touching Hearts, Touching Minds resources. The messages, supporting content, video clips, and rollovers can be incorporated into web-based education to supplement the corresponding topic. The videos on DVDs could be used to communicate the messages in waiting areas by showing them in a repeating loop. Increased access to the Internet makes it possible to reach more people more often with nutrition messages and related tips and advice. You can use the Internet to carry the messages to moms by building the messages into social marketing and outreach efforts. Use social media to draw moms to your online resources and messages such as Facebook, Twitter, blogs, and outlets that reach specific ethnic and population groups. On the right of this slide is an example of a USDA tweet and Facebook page featuring the Family Meals message. On the left of the slide is an example of New York's Just Say Yes campaign, which you will hear more about in the next webinar in October. There are numerous ways the core messages and related materials, both in print and traditional media formats, can be used. This slide lists several examples you might consider incorporating into your programs. You can also use the core messages and resources to support statewide collaborations, and I'd like to share how this is happening in Oregon. The Nutrition Council of Oregon is a diverse group of nutrition professionals from Oregon's public health, education, and healthcare sectors. Members include the WIC program, Extension, Oregon Department of Education, Oregon Dairy Council, Aging and People with Disabilities, SNAP, Oregon Food Bank, Head Start, Northwest Portland Area Indian Health Board, and more. This group decided to incorporate the Family Meals core messages and supporting content into their Shared Meals initiative. They also used the Maximizing the Messages document to guide development of materials and resources. Outcomes of the Family Meal promotion include a governor's proclamation promoting September as Shared Meals Month, frequently asked questions with talking points for promoting the messages locally, and session guides to use with participants in nutrition education groups to raise awareness of the importance of family meals. Additional supporting materials are still in development. In deciding what you will do to get your messages across, it is important to keep it clear, focus on one or two behaviors, connect with moms, address what matters to them, and take your message to them, use stories when possible, and provide options from which they can choose. I hope this has given you some ideas for how you can apply the core messages in your own programs. You can find all of the core messages and the supporting materials at the FNS website. The link is here on the bottom left of your screen, and it is also on the registration materials you received earlier. You can view these materials by topic and audience by clicking on the sidebar or the links. In addition to these materials, you will find background information, the communication tools, research highlights, training materials, and specific examples from various agencies for how they are using the messages and resources. We hope that you will use these materials to jumpstart your new and ongoing nutrition education projects and invite you to share your work with us at the email listed on the slide. We will now address a few of the questions we have received so far. You can still go ahead and submit questions through the note feature on your screen. If we are unable to get to all of the questions, we will post a frequently asked questions on the training material webpage and share it via email.
So we've gotten a few questions. Are people able to hear me?
Yes, they are.
We've gotten a few questions about where you can get the materials and about the photos. We will be providing information on where you can access the photos. Many of the photos were purchased online by USDA and are very inexpensive, so we are able to give you the sources where you can go and get those photos. Some of them, however, are owned by USDA, so you can contact us and let us know which photos you're interested in. Being very specific, it would be good if you would send like the actual photo in your email to show us what you're looking for. Tell us how you plan to use it, etc. We are limiting use of the USDA core methods photos with products that relate to the core messages. So bear that in mind. Thanks. Mimi, are there other questions?
Sure, and I just wanted to add on to that as well, Judy. The Snap Ed Connection also hosts lots of different pictures that would fit in with the core messages as well, and those can be used for free. So we can send out follow-up information about that. And there were some questions just about how to access recording of this webinar, and we will be getting that together and post it online. I will have AT&T send out an email to all of you all when that is available, so you can go back and review it when needed. And I'm just going through some of the questions now. So one of the questions is, it appears the data on smartphone use is from the 2007 focus groups. We suspect that more low-income moms have smartphones now. Do we have any more current data on that?
The data on the smartphone use is actually from the 2010 focus groups, and the numbers jumped tremendously. Remember, we said that they all had phones with internet access, but only 25% of them indicated that they actually had smartphones. But again, you can't put too much credence in that specific number due to, the type of research that we were doing. Mm-hmm. So I would look at the census data as a great source. However, I think this is pretty consistent with what the census is saying and what, Joyce, what's that other source that we used?
Pew Internet data.
Right, Pew Internet. So you can look there for information too. Our Western Regional Office did a technology survey, and I don't know if anyone's, but we could talk to them and share that information with you as well, because their data is much harder than the data we are talking about today. But we could share that with you when we do the responses to other questions, if there are any.
Okay. And then, Judy, I have another question, too, and this is not just for Judy, it's for all the presenters. But the question is, why is there an exclusive focus on moms? Do you worry this may adversely impact other caregivers, especially since the family dynamic is so different now from what it has been historically? For example, there's more mom in the workplace, more dads at home. Thank you for the webinar.
Sarah, would you like to take a stab at that, or?
Sure. I think from when we were doing I guess part of the research is that the moms are the gatekeepers of the family as far as what, foods come into the home. And certainly it would be important to share this information, with other caregivers. But I think that was the intent, and you correct me if I'm wrong, Judy, that's why we focus it on the mothers.
That's correct. And if you look at the CDC Health Communication site and look at the notes that they have there and some of the research there, while certainly the comment is a valid one and that the trends may be shifting, mothers still are the predominant food gatekeepers in the home based on that data as well. So that is why we are focusing on moms.
Great. Do we have time for one more?
I think so. One more.
Okay. Do you see a pattern in who emerges as the lead agency for local collaboration? I guess that's in terms of local collaboration of using the core nutrition messages.
I think anyone who has the motivation, the inspiration, and the time can emerge as a leader. And I encourage all of you to, pick up the banner and go out there and lead the charge because this is very important work that you are doing. And so your training and your background provides you with the skills. And so pick it up and lead it. I don't see any emerging trends. I think personal interest and conviction is, key to success.
That's great. Anyone can do it. And then I have one more, Judy. This is a good one. Your work developing messages started in 2006, and it's 2013 now. How long will these messages be relevant? What is the shelf life?
I think that's an excellent question. And I
thought so too.
you have to, you are the primary gatekeepers of how long these messages will work. Interestingly enough, when we did the 2010-11 studies, and even in testing the Spanish materials this year with Spanish-speaking mothers, the translation, they got it. They were into it. But as Joyce mentioned, the Spanish mothers made a tweak on the happy kids, happy tummies. They thought happy tummies, happy kids was a better message for them. But they love these messages. And if I could quote one of the moms, she said, when I read these, they made me cry. They really touched her heart, is what she was saying. But as you do your development and as you get your input from consumers, you will see if there's a shift. And when you do, I hope that you would let us know. So, Mimi, I think with that, we should probably move into the wrap-up.
That sounds good. Okay.
All right. So, before we close, we want to remind you to complete the offline activities. About 350 of you have registered for this. You will get hands-on experience in using the messages that will hopefully help you to use them more effectively in your practice through the hands-on experience. And if you also sign up for Part 2, October 3rd, and that hand-on activities, once you submit your draft to us, you will get feedback from the team here today as well as from some of the people who were on the work groups for the core messages, and that will help you even further to advance the creation of your tool. So I just wanted to remind you of the due dates, which is shown on our next slide here, Eddie. The reading and the Q&As should be submitted to us by the 23rd. Mimi emailed the materials out to everyone who signed up for the online activities for this session. I believe that was yesterday or the day before, Mimi. Is that correct?
Correct. I sent some out this morning as well, and I'll do one last check after this webinar because people were signing up until 2 o'clock. So I'll do one last clean sweep.
All right. And then you can expect to get the questions relating to the readings starting tomorrow, if not today. So you will get the questions. So we ask you to respond to those by the 23rd. So we're giving you more time because we're late getting them out. The worksheet, which is just a tool to help you think through and plan what you want to do, is due on the 23rd. And then you should complete the draft and redrafting of your tool by the 2nd of October before the next webinar. But you don't need to submit that. You will submit that after the last webinar in the series. So with that, we'll move on to the next slide. Based on the next session, you will refine your tool. You will retain some consumer feedback, and we'll be talking about how to do that in the next session. You will revise it and submit it to us, and then you will get your feedback. Now, those of you who are registered for the offline activity for this session, you have already received the registration information for the next session. So go ahead and sign up, because we want to make sure that there's continuity, that the people who did our offline activity for this session have first chance at being a part of the offline activity for the second session. But we are only able to accommodate 100 people in that session, so I urge you to go ahead and sign up for it. Please, when you get the feedback form that Mimi will send you today or tomorrow or maybe Monday, please take time to provide us with your feedback. We want and need your constructive criticism. We apologize for any technical difficulties that we have today, but we will be smoothing those out for the next webinar. And if there's anything that you want, that we talked about today, that you want to know more about, such as the research on child feeding, et cetera, let us know, because we do plan to do a couple of more webinars early in 2014. So we want your input into what you would like to see us address. And then finally, and my last slide, is just a big thank you for all that you do every day to help people across this country to eat better and to live healthier lives and to be more secure in their food availability. You do a great job, and on behalf of all of those that we serve together, I thank you.